Hello all. I welcome you all to today's lecture that is based on Telecare and Ehealth. I'm Dr. Anahita, and today I will be talking about Telecare. I will give you a complete overview of this lecture and I will introduce this concept to you all today in this lecture. Now, Telecare, many of you must have heard this word, many of you must be practicing telecare, or maybe you may be giving teleconsultation to your patients. Nowadays, telehealth, telemedicine, teleconsultation, telemonitoring, telecare, all these concepts are quite trending. And you will see scientific literature, you may see various articles that are nowadays getting published, you may see various interventions, pilot studies that are getting done by the researchers that is based on these concepts so that they can make their healthcare services easy, efficient, and more accessible to the patients, especially those who are living at remote locations, maybe in rural areas, maybe in other remote areas where they cannot visit a doctor frequently, they cannot come to the hospital or to the doctor's clinic frequently. And as a solution for this problem, this concept of telehealth, telecare, telemedicine is quite trending nowadays. It has become quite popular, especially after coronavirus pandemic, during which people had teleconsultation, people had telemedicine basically. The doctors were available online, they were available for video conferencing, for the phone calls with the patient's family, so that they can provide their services via telephone or video conferencing. So this practice has become quite trending, quite popular, especially after coronavirus pandemic. And not just it has become popular or trending, but it is very useful nowadays. It is proven a great use of technology in medical sciences, in healthcare, by the practitioners, by general physicians, by nurses, by the hospitals, and even researchers like public health researchers or epidemiologists. So, in today's lecture, I will be talking about one of its concepts, that is telecare, though I will take you through the other important terms as well, like telehealth, what is telemedicine, because you may get confused with these words. You may think that these words are same, they are synonyms. However, many a times these are used interchangeably, but these do have their own definitions. So I will also tell you those definitions, the actual meaning of these terms, and I will keep my focus on this specific concept, which is telecare, that has evolved by a beautiful amalgamation of information technology and healthcare or medical science. So this beautiful collaboration of ICT, basically information and communication technology, along with the healthcare, is very useful. It has become a helpful tool, a very big support for the patients as well as for the healthcare professionals, for the medical professionals, to provide their services even to the people who are living remotely. So, in terms of accessibility, in terms of availability of healthcare services, everything has improved with the help of this collaboration. So, in today's lecture, firstly, I will tell you what is telecare. I will tell you the definition, the basic meaning. I will also talk about other important terms, as I told you, about telehealth, telemedicine, etc. And then I will tell you what are different telecare services, what are different telecare devices and systems nowadays that have been uh, developed by the researchers, by the medical professionals, what are different pilot interventions that have been done. I will be talking about two such examples in today's lecture. Now, if you know about population of a country, if you have little knowledge, even the basic information about a population of a country, you must be knowing that a population of a country keeps changing in terms of its size, in terms of its distribution, whether it is gender-wise distribution or age-wise distribution. So basically, we can say this is demographics, basically the demographic characteristics of any population in a country keeps changing with time. It is true that every country has its own demographic profile, right? And this keeps changing, and this is called as demographic transition. So transition is basically the changes that occur with time, the transformation that occurs with time. And when we are talking about the demographics is basically related to the people, to the population of any country. So it keeps changing, the characteristics keep changing. Very common example of such demographic transition or change is age distribution. So change in the age distribution of any country. So because of this demographic transition, because it is natural, we cannot stop it, we cannot control it. With an aim that you stop this transition, you stop this process. It is like a cycle that keeps on going, and it has many stages. Altogether, it has 4 or 5 changes, and every country undergo these changes. So if country A is at stage 2, after some time it will enter stage 3. And if a country is at stage 4, maybe the last stage of this change, the country will enter again into stage 1. So it is like a cycle, like a continuous process that keeps on going. Now, because of these changes, what we can do is that we can provide, we can develop, or even we can improve our healthcare services, the delivery of healthcare services that we are providing to that population of a country. So this can be done with technological advancements. Of course, with medical sciences, with new therapies, new drugs, new discoveries, we can do that. But equally, technological advancements, technology is important for this efficient and improved healthcare delivery to the people, especially if we are talking about a specific group of population, a specific group like some vulnerable group. For example, children, or it could be older people who are above 60 years of age, or patients who have some chronic illness, who have some long-term conditions, they need some long-term care. So these are basically specific groups within a population who need continuous healthcare delivery, who need continuous healthcare services. And because of these changes in the demographics, we need to keep our focus on efficient and improved innovative healthcare delivery to these specific groups of people, these specific groups of population, or these people, or maybe patients are basically vulnerable groups, vulnerable people within a specific population. And therefore, this can be done with the help of technological advancements. As I was talking about demographic transition that occurs, that every country goes through, and every country has its own demographic transition. Every country is in some stage of demographic transition, starting from stage 1 till stage 4 or 5. So what happens in this transition is that the birth rates, the fertility rates basically, and the death rates keeps on changing in every stage. So every stage has its own characteristics, and naturally, because I said it is like a cycle, it is a continuous process, and it is a natural process, we cannot stop it. Therefore, there is some natural increase or decrease in birth rates and death rates in any country. So this is what is demographic transition. And because of these changing rates, because of these changing birth rates and death rates, naturally, what happens? The distribution of the population also gets affected, and it also changes. The distribution of the population in terms of age and gender. So specifically, age and gender distribution of any population gets affected by the changing birth and death rates of any country. However, there are many other factors for these demographic. transitions for these changes. So not just some natural increase or decrease in birth rates and death rates, there is migration. There could be some economic conditions. There could be some crisis in a country. There could be some war conditions, some political changes, or some natural disasters that may lead to increased death rate within a country. So all these things basically affect health status of any population. So because of these things that are changing due to various factors, the health profile of that population also changes. It gets affected. Now, apart from demographic transition of any country for any population, another factor, important factor is epidemiological transition. The epidemiological transition is basically related to the epidemiology, which is the occurrence of any disease within a country, within a population of any country, its pattern, its frequency. So, what is the frequency of any disease that is occurring, that is present in a population? What is the pattern? What is its trend, disease trend? So, this also keeps on changing. So, because of this epidemiological transition, the disease profile of any country also changes. For example, you must have heard about communicable diseases. Those are basically infectious diseases that may spread from one person to another. Those are infectious in nature, just like coronavirus. That was quite infectious in nature. Similarly, we have non-communicable diseases. So those are basically chronic conditions like cancer or blood pressure. It could be some re-emerging diseases as well, such as cholera, or we have malaria. So epidemiological transition is basically change in the disease profile, change in the disease occurrence, disease frequency, disease trend in any country, in any population. So for example, now you may have heard, you may know that countries are facing double burden of diseases. Now, that is quite true for most of the LMICs, the lower middle income countries. Similarly, nowadays we are seeing triple burden of diseases, meaning a single country is having communicable diseases, it is also having non-communicable diseases, and at the same time, nowadays it is also having re-emerging diseases. So this is like a triple burden of disease that a country is having. So this is epidemiological transition. If you look back at the history, the historical time, there were communicable diseases that were present within the populations, within countries. For example, cholera. There was cholera. There was tuberculosis. There was plague. Nowadays, what we see is non-communicable diseases. We see the prevalence of non-communicable diseases has increased within the populations as compared to the communicable or infectious diseases. And at the same time, nowadays we also see re-emerging diseases that are again emerging, that are again occurring within those countries, within populations. So this is epidemiological transition. And apart from demographic transition, we have this another factor that is responsible, and it is epidemiological transition, because of which the health status of entire population as a whole gets affected. The disease profile of the population changes. Now, because of these factors, what happens? There is a change in the health demands of the people. There is a change in health needs of the people. Giving long-term care or giving care to the people who are having some disabilities, it becomes challenging. And ultimately, the health expenditures also increase. So basically, we can say it also has some negative or adverse impact on health expenditures as well. So, because of these factors like demographic transition or epidemiological transition, there are such challenges that every country face. Now, looking at the current status for a specific group of people, that is elderly people. So, it is said that between 2015 till 2050, the world population who are above 60 who are 60 or above 60 years of age will double from 10 to 22%. Also, it is said that by 2100, it will triple to 30%. And in 2050, it is said that 80% of these older people will be living in LMICs. Now, what is the reason that we are now suddenly seeing we have such projections, we have such estimations, and it is said that the older people population will increase in entire world. What is the reason? It is because of the advancements in medical care, improved nutrition, improved healthcare services, changes in lifestyle, changes in habits, and also decrease in fertility rates. So because of these reasons, it is expected that we will have an increased population of age 60 or more globally. Now let's talk about the main topic of today's lecture, that is telecare. As we saw that there are various factors that affect the health status, health profile of any population, and there are many challenges that healthcare professionals may face. For example, providing service to the people, to the patients who need long-term care, or those who are living remotely, those who cannot access healthcare services more frequently. So there are various such challenges because of demographic transition, because of epidemiological transition that any country may face. Now, as I said that we have such a beautiful collaboration of advancements, technology, and medical care or healthcare. And telecare is one such example that we have today. So telecare is basically use of technological advances so that we can provide efficient delivery of healthcare services. So this basically will help us to give improved, efficient healthcare services to the people who are in need. Specifically, some special groups of people like elderly people who are 60 years of age or above 60 years of age. So there are many such people around the world who live within their homes, maybe alone, who are 60 or above 60 years of age, or maybe those people have some chronic illness, some chronic conditions, or maybe they need some long-term care. So with the help of this technological advancement, with the help of this telecare, what we can do, we can reduce their needs for clinical visits and costly home care. So as I said, there are such people who are living within their homes, maybe in rural areas, maybe remotely, who cannot come to the clinic, who cannot come to the hospital frequently, who cannot have follow-up visits frequently. So, for reducing their needs, reducing their frequent follow-ups, frequent clinical visits, and also their health expenditures, such as if for a professional home care. So the costly expenditures will be reduced. So to address these challenges, to address these problems, we have a solution, and that is telecare. So if we look at the basic meaning of this term, telecare, it comes from a Greek language. Tele means at a distance or remotely, and care is providing something what is necessary for health. So that is care, and we have tele. Tele means at a distance or remote. So telecare is basically remote patient monitoring. It is personal safety of the patient, of some individual. Also providing some care remotely to the patient. So this is telecare. So basically, without having a physical contact with the hospital, with the doctor, maybe with the nurse, the services are provided to the patient without having a physical contact. So that is at a distance. So the services are provided remotely. Specifically, patient monitoring. Specifically, when you are concerned with the patient's safety or you want to monitor patient's symptoms. You want to keep an eye on patient's progress, health progress, maybe after some operation or after some treatment. You want to keep some follow-up about the progress of the patient's health. So all these services are offered remotely. So what is our aim behind this telecare? So our aim is to help people who are living alone, who are living independently in their homes. We want to support people in terms of their care and well-being, to improve their well-being, to provide them care. We want to support people. We want to empower such patients, such people, specifically a specific group of people. We want to empower them. We want to support them. So this telecare is based on the use of ICT, which is telecommunications technology. It is also information and communications technology. So this is basically ICT, and it provides continuous support, continuous monitoring. And this is actually 24/7 monitoring that is provided through telecare. So this, as I said, Telecare is a continuous 24/7 monitoring service which is given remotely. And it is quite helpful for real-time emergencies. If there is some emergency situation when the patient is living alone, or if there is some lifestyle changes that has occurred over time, you want to monitor the vital signs of that patient, maybe for diagnostic purposes, maybe for some assessments, or to prevent some conditions to occur. You want to keep monitoring, you want to keep checking their vital signs like blood pressure or heart rate or respiratory rate, etc. So for all this, you can take the help of telecare. Also, it is helpful to manage the risks that are associated with independent living. So, for example, cases of falls in the bathroom are very common. They are frequently reported, are very commonly seen among elderly people. So, if you want to prevent that fall, if you want to prevent that accident that may happen, similarly, there are fire cases that are reported. So, if you want to prevent fire that may occur within the home, if the patient is living in isolation, if the patient is living alone, if you want to prevent these things, these accidents to occur, to happen, then again you can take the help of telecare to manage those risks that are associated with such accidents. Now let's talk about other similar terms, similar concepts, though I will be telling you the basic differences and meaning of these terms. Many a times these terms are used interchangeably or as synonyms. So till now what I told you is about telecare, though there are many definitions of telecare, and those are actually conflicting because every researcher, every author may have it may have its own definition, own meaning of telecare. So what I told you was the basic concept of telecare, the general concept, the basic meaning of telecare. If you go through some textbooks, you may find various multiple definitions of telecare given by different authors based on their own understanding of this term. Now, what we have is telemedicine. Telemedicine is again from Greek language, tele and medicine. We have two different terms, tele and medicine. So tele means again at a distance, something that is provided remotely, and we have medicine. Medicine related to the treatment basically. Medicine that you deliver, that you provide at a distance. So this telemedicine is different from telecare because telemedicine is restricted. It is provided only to the patients by a clinician. Someone who is a doctor, like general physician, can provide telemedicine to his or her patients. Whereas telecare can be given to anyone, any person who is in need of some monitoring, some support, some empowerment. Whereas telemedicine can be given only to the patients by a doctor for the treatment. The purpose is basically treatment. The purpose is basically treating some disease, curing some disease. But it is done at a distance or remotely. So that is telemedicine. Now, telemedicine is again based on using ICT, which is information and communications technology, that can deliver all kinds of medical information or services, diagnostic services, and also treatment related services. But all these are basically the clinical settings related services, the healthcare services that can be provided by a doctor who from a clinic or maybe from a hospital. So all the services that you get from a clinic or from a hospital are given through telemedicine. So this is basically remote clinical services only. This is an important line for telemedicine that you should always remember. And telecommunication, because it is ICT based, so we have telecommunication also. Apart from the information, the technology, we have communication also, meaning there is sharing of medical information as well with the patient by a clinician. Another term that we have is telehealth. Now, telehealth is like one step forward from telemedicine. So, telemedicine was restricted to clinical services only, to the medical services or medicine that is provided, but telehealth is one step forward and it includes both clinical and non-clinical services that is given remotely. Now, telehealth uses ICT and electronic information as well. So basically, it is a long distance clinical healthcare service that is provided. There is also health education that can be provided. There is also some health administration, some management also that can be done. So all these clinical and non-clinical services like patient counseling or patient education, etc., health promotion, education, etc., all this can be done with the help of telehealth. So this is again little different from telecare and telemedicine. Now we have e-health, and most preferred term for this e-health is basically digital health, which is preferred by WHO nowadays. So you may see the scientific literature, you may see various published articles, even textbooks, you will find this term e-health, or rather you will see digital health. So this is basically based on electronic system, and it includes or it uses all types of information and communication technology. So that is again ICT, where information and communication technology is used for this electronic system. This electronic system is quite helpful, it is beneficial, and at the same time it is cost effective to use information to you and communicate that information. So basically there is use of information and communication technologies, and it is a cost effective solution. It can be used for all health related fields. So it is not just restricted to the patients given by the clinicians, or it is not restricted to public health, but this e-health is used, can be applied to different health related fields like biomedical research, or there is health literature, healthcare services, even for surveillance purpose where you want continuous 24/7 monitoring of a disease profile maybe, or cases in a hospital, maybe within a specific community, even for health education, knowledge and research, etc. So e-health is like electronic system that is used. So nowadays you may see various websites, various mobile applications that are available for health education, for prevention, for health promotion as well. Also nowadays there are various screening tests, assessments that can be done through the website. Those can be done online. Similarly, we have records, the record system, where you record and maintain patient data. For example, within a hospital, nowadays they have their own customized software where they enter patient data. So the entire medical history of that patient is recorded Entire information is recorded in that software. So those are Ehealth records basically. So again, that is based on Ehealth system or electronic system. Now here is an example of e-learning environment. Just like you have this e-learning system where you access different modules, you access different lectures, you gain some information. Similarly, we have a common platform that is online, that is e-learning platform, and it can be accessed by different students through different modes like mobile phones or maybe laptop or computer, etc. So those are different modes, different ways basically or means of accessing that information which is available at a common platform. So this is an example of e-health. Now we have Mhealth. Mhealth is basically mobile health, which is different from telecare, telehealth, telemedicine, etc. So Mhealth is basically a part of e-health, we can say, and it is based on using mobile or wireless technologies. So wireless technology, if you have something, if you have some equipment that is wireless, you can carry it anywhere and you can access information, you can use it anywhere, anytime. So in terms of accessibility and availability, it is improved with the help of Mhealth. Therefore, it is called as mobile health or Mhealth because it can be accessed anywhere at any point of time. So you may use different applications within your phones, mobile phones. Many a times we have SMS or text messages for health education, for health promotion. Many a times people registered with specific hospital, they get frequent text messages as reminders. Now people also get reminders for taking medicine every day. So there are different ways where this mobile health is actually used. So in short, you can see this structure, basically this framework where you see telemedicine. Telemedicine is related to curing the disease or treating the disease, treating the patient by a clinician. And then you see telehealth, that is quite broader, and telemedicine comes within that telehealth. So telehealth provides clinical as well as non-clinical services, and you can see the place of telecare, which is a subset of telehealth, but it is out of the scope of telemedicine. So it is an integral part of telehealth actually. And then the outermost circle you see is e-health. So this is a framework where these different concepts actually lie. Now let's come back to the main topic of today's lecture, which is telecare. And now the question comes, what comes under telecare? We have seen the basic meaning of this term telecare, which is tele and care. So the care, the services, basically the healthcare services that are provided at a distance. So as I said that this telecare uses ICT, which is information and communication technology. It is also based on alert system or alarming system and sensors. So basically the sensors or sensing technology is also used in telecare. It can be used for monitoring purpose. So monitoring, like if you want to monitor lifestyle changes that have occurred over time for a specific patient, you can have such social lifestyle monitoring system. You can have some behavioral monitoring system. You can have even environmental monitoring where you can look at the environment within the home, the environment that may act as a risk factor for the patient's health. So all these monitorings can be done with the help of telecare, and this monitoring is done by a monitoring team. So we have a telecare center where we have a team at that center, which is a telecare center, and they provide 24/7 monitoring services to that patient. So these are done with the help of various electronic devices basically that are developed, that are available even in the markets. Those are commercially available. There are various companies who manufacture those devices, those electronic devices. So those electronic devices are basically installed within the homes of the patients, and then the monitoring team that is working at the center will have a 24/7 support and assistance as well as monitoring for that specific patient with the help of devices. Just like we have a web camera or we have some CCTV that is installed within a building. So CCTV is again like is used for monitoring. It is used for surveillance. So a camera that is used for surveillance, that is some electronic device that is used for monitoring purpose. Similarly, in telecare, we have different electronic devices. We have different alarming systems. We have different sensors. We have such technology that is used for telecare. So this ICT, this technology in telecare is used for curative healthcare delivery. That is when you want to cure some disease, as well as you want preventive healthcare. That is in terms of prevention. Just like in previous slides, I gave you an example of patient falls. So when you want to prevent falling, when you want to prevent fire, so those are basically the preventive healthcare, where you want to prevent the risks, where you want to monitor the risks that are associated with some accidents, with some maybe some conditions that may occur, and with the help of telecare, you want to provide that prevention through monitoring. You want to provide preventive healthcare, you want to provide curative healthcare. But the important thing that we should remember is the distance. It is not given physically, but it is given at a distance. That is the main component in telecare. Now let's look at different telecare services that are available. So we have a broad range of services given through various electronic devices. We can have personalized monitoring, we can have personalized care services, we can have preventive healthcare services. So we can use sensors. As I told you, we can use different electronic devices that are manufactured by different companies, and we even have commercially available devices that can be installed within the homes. So those are basically based on different systems like sensing or alarming systems. So we can have sensors, we can have some fall detectors, smoke detectors, we can have gas detectors. So basically those work on sensing technology. Then we can have alarms, personal alarms that can be worn by the patient as a bracelet or as a pendant, and then we can also have other telecare devices and systems. So I will talk about these one by one in telecare services. The first one is personal alarm. Now this personal alarm, as you can see in the picture, the patient is actually wearing it in her wrist. So these alarms basically can be worn, or these can be carried with the patient. These can be worn around wrist or maybe neck, around the neck as a pin. So basically, because it is an alarm, a personal alarm, it makes loud noise to alert the people who are sitting nearby, or maybe to alert the monitoring team who is connected 24/7 at the center. So this alarm sends an alert to the patient's family as well as to the monitoring team that something has happened, something is problematic. So these personal alarms are quite helpful. With the help of these personal alarms, you can provide 24-hour, 24/7 monitoring service to the patient. Also, for these alarms, there are fall detectors that are built into these personal alarms, or you can have a separate electronic device for fall detector as well. Then there are GPS tracking systems. There are alarms that also include GPS tracking so that you can know the exact location of the patient. It is helpful for the family to know the location, the live location also. So basically what we have is the base unit. Now in this picture you can see we have a unit, a big unit, base unit. Basically it has a microphone as well as speaker. So when the telecare team called sender team speaks to the patient. Because of the speaker, the patient is able to hear the voice. And with the help of microphone, the patient can respond back. So it is like a telephone that can be used for communication as well. And this is also connected to the alarm that is worn by the patient, maybe in the wrist or around the neck. And it has different functions like help button, cancel button, or home or away button that patient can use based on their need, based on their situation. So this is basically the main unit, the base unit of this alarm system. Then another thing, another device that we have is this alarm or this pendant, red pendant that you can see in the picture. So it is waterproof. It has many features. It is waterproof. It has a red button that can be pressed by the patient when there is some emergency, when the patient needs some help or some support by the family member or maybe by the call center team, the telecare team, which is available 24/7. So this red button can be pressed in case of emergency. Then we have pendants. These are different from alarms. We have pendants that can be used to detect fall. These are worn around the neck of the patient, and these pendants actually automatically detect a fall, and these pendants, after detecting a fall, sends an alert to the family, that alert message to the family or to the call center team. It also has a LED light that is installed within it and a vibrating system basically that vibrates. So when there is a light and vibration, it means there is a confirmation of fall. Then we have automatic alarm devices at home. Now these are different from the previous alarm system because those alarms or those pendants do not work automatically. Why? Because it had a red button as you saw in the picture. So whenever a patient had some problem or some emergency, the patient had to press it. So that is the thing, and that is why it is not automatic. But here we have automatic devices that are installed within the home. These are not worn by the patient, but these devices are installed within the home and these are automatic in nature, meaning that the patient need not to press some button for sending an alert message to the family or to the call center team. So basically, this is second generation of home telecare service. So previously we had like a first generation of telecare service. Now this is the second generation of home telecare service. So these detectors basically automatically detect some smoke or gas or some water leakage if it is there within the home. So what happens? It works on the sensor system and it activates a sensor that causes a direct alert message or a direct call to the center team, telecare center team. Now here is an example. We have smoke detector. Now smoke detectors are very common. You may have one installed in your home, but these are little different. When you have this for telecare purpose, for telecare service, these are little different because there is no false direction of any smoke. Though it is based on detecting smoke and it is linked to alarm base unit, the main unit, and it sends some alert message, a direct call to the team for help. It sends a radio signal. But it is different from those traditional detectors, smoke detectors that you may have one in your home because these detect rise in the temperature that is associated with the fire. So a smoke that has been caused by a fire that is coming from the fire, and because of fire, if there is a fire in the home, the temperature of that home is going to increase, of or maybe of that particular room it is going to increase, and when there is increase in that temperature, it is going to detect that increase in the temperature. So after detecting that increase in the temperature, it will send an alert to the call center team. So these smoke detectors are installed onto the ceiling and it has two different alarms. One alarm will be present within the home, and second alarm will be sent. Basically, the signal for some alert or some alarm will be sent to the call center team. So these are helpful because these reduce the risk of life that is associated, and as well as the risk to the property because of some fire. Then we have fall detectors. Fall detectors, previously also in the first generation of telecare services, we have pendants for fall detector. Now these fall detectors are also present in second generation of telecare services because these are present based on alert system technology, and these identify and give emergency assistance to someone who is prone to falls. So it is based on sensor activation that occurs after falling, and these are placed around the neck or maybe wrist or even sometimes around the waist of the patient. Now, because these are based on sensing technology, we have different types of sensors that are used for fall prediction and detection. The first one is motion sensor, which is based on the bodily movement or motion of the patient basically, and key sensor in motion sensor in this type is accelerometer. So basically it detects any variation that is occurring in body acceleration. So acceleration is what? It is object's velocity that changes with respect to time. So if the velocity of the body is changing it with respect to time, it is going to detect that change, that variation. And if the body acceleration exceeds the threshold value, the predefined threshold value, it means there is some fall. So this is motion sensor, which is one type of sensor system, a sensor type, basically that is used for this purpose. Then we have physiological sensors, which is another type of sensor. Now these physiological sensors basically monitor the physiological indicators or vital indicators of the patient, such as heart rate, pulse rate, respiratory rate, etc. So these physiological sensors can be placed at different parts of the body, the patient's body, that will help to monitor the vital signs of any patient. Now here, as you can see in this picture, the patient is wearing a sensor, the physiological sensor that is monitoring the heart rate and respiratory rate, and it is connected to the GPS system, and the information with the help of the direction of arrow, you can see the information, the data basically is flowing to the family, to the clinician, and even to the emergency department if there is some emergency, in case of emergency, through internet, as you can see. And based on that data that is received by the family, by the hospital, then you can see again the direction of the arrow that is going towards the patient as part of intervention that is done. So this is the monitoring that is done with the help of these sensors. Third type is environmental sensor, that is useful to measure environmental phenomena such as what is the humidity in the room or maybe in the home, what is the pressure level, sound, temperature, etc. So these are basically ambient sensors or ambient temperature sensors that help maintain healthy temperature within the home. And these also help monitor for some unexpected changes in the environment of a room or maybe of the home. Also, these provide early warnings of hazardous temperatures. Hazardous temperatures are basically the extreme temperatures than the normal that may act as favorable temperature for bacterial growth, for fungi growth, etc. So those are basically hazardous temperatures. So with the help of these environmental sensors, you can you can monitor the temperature, you can maintain healthy temperature, and you can also look at the hazardous temperature, the early warning for hazardous temperature. So these sensors, these environmental sensors are basically mounted on a wall within a room or maybe in every room of the house to monitor the high temperature, extreme high or some lower temperature that may occur than the normal. So you can have a predefined temperature. So if you want to keep the room temperature at 22 degrees Celsius, so if it goes above this or maybe below this, it will send you some alert, some warning. Now we have telecare systems, which is like the third generation of telecare services provided at home. And in this entire system, we have different devices, we have a team, we have the patient's family, and then we also have technology like GPS, we have sensors, we have internet, etc. So basically the information or the data is collected and it flows from the patient to the services or maybe the service providers, basically like hospitals or the clinician or the team, family, etc. So these systems will help them to take decisions, to make some important decisions about the risks, the risky situations, the risks associated with the patient's life or maybe health. So as you can see, the data is basically transferred from the patient to the team or maybe to the hospital or maybe to the clinician. It is analyzed remotely for decision making. And it can be done with local authorities who provide such personal alarm and monitoring services. So basically, we have this complete network within this telecare system. We can have general practitioners who provide primary care services. We can have hospitals who provide secondary and tertiary care services. We can have also commercially available companies, NGOs, and other agencies who provide these services. And here, as you can see, the network of the system, how it is connected. We have the center, we have different models, and we have the hospital. Then we can also have a department from social welfare. Then we have nurse also that may get connected in this network. Now coming to the benefits of telecare, yes, we do have some benefits of telecare, as we can keep a track, we can monitor the behavior of the patient, we can identify some risks, some risk factors that are associated, some early warning signs and unusual behavior of the patient. We can make emergency calls, we can send or the patient can send basically emergency call or alert message to the managing team, to the call center team that are 24/7 available, that stay connected with the patient. So we have many such benefits of telecare. Now let's look at this telecare system, basically this example. So basically this was a pilot study, some pilot intervention that was done, and this telecare system was named as Talisman. And this is advanced telecare system that was developed, called as Talisman, developed by the researchers in Madrid, in one of the universities of Madrid. So basically they developed this system, telecare system, to collect and manage environmental data for the users, for the people. Though it was a pilot intervention that was done, so they collected and managed environmental data. So basically they wanted to detect some risky situations that may occur within the home of the user. And this talisman provided information, important data and information to the telecare professionals so that they can make quick decisions and efficient decisions. So basically, they have this system within ADH. ADH is basically accessible digital home that was developed, that was created, and the system was installed in that home. So it is like a real home, which is around 80 meters square. It has a hall, it has bedroom, it has kitchen and bathroom. So this is a small home that was built by the researchers, and within that home they installed this talisman system. So what they have done, basically they have installed different sensors within the home, within this ADH. So there are different sensors in every room that are installed, and then it also has a central unit, the main unit, which is like a base unit with which all the sensors are connected, and it also manage all the data, the information that is collected by different sensors. So that is the main or basic telecare system that was developed. Now in these pictures you can see the first 5 pictures, you can see as highlighted with this red box. We have different rooms of that home. We have hall or living room, bedroom, bathroom, kitchen, and there are different sensors that are placed, controlled by this talisman system. Now you can see the last 2 pictures. Those pictures are basically the main unit or the central unit that it has, and all the sensors are connected with this main unit, and this main unit will help manage and collect all the data, and it will transform that data to the call center team for efficient and quick decision making. And it also has this interface, this monitor interface that can be accessed by the monitoring team, and you can see it has various information, important information related to the patient, like its personal profile, its clinical profile, environmental sensors, etc. So all the information is displayed on this interface of Talisman. Here is another example of multi-sensor respiratory swallow telecare system that has been developed in Taiwan. Now this has been developed as feeding telecare system. So basically it is like a semi-automatic feeding telecare system to monitor feeding behavior and alerting. So basically the swallowing information after every meal can be collected by this system, and the data or the information that is collected is uploaded for the assessment, and it provides instant feedback and warning on site and as well as remotely to the monitoring team. Now you must be knowing that while swallowing or while eating, if a patient is swallowing during the meal, the breathing stops, and to keep a monitor or keep an eye on the swallowing of the patient, or we can say remote respiratory swallowing, this system was developed so that it can send the signals of swallowing and respiration from different sensors. So the patient has to wear 3 different sensors that will collect this respiratory signal and swallowing signal. So this information will be helpful for proper feeding positions for older adults as well as people with disabilities. This information will help them have proper feeding positions so that it will prevent any risk or any adverse situation that may occur. So in this again picture, you can see the sensors that are placed over the patient's body, and then there is a circuit, how it works, and finally we have this model, this entire telecare model. So basically we have the patient, it can be some older patient, it can be some patient who is having swallowing disorder, and if that patient is wearing this portable system, these sensors basically, it is going to send some risk warning, some information to the monitoring team, and in turn this information will improve the eating strategy, feeding strategy, and it will also provide proper feeding or swallowing positions that can be told to the patient, and in turn again it will keep assessing and monitoring the patient's swallowing and respiratory signal. So this is the basic respiratory swallowing telecare model that has been developed. So as a conclusion of this lecture, always remember that telecare system is based on ICT, which is information and telecommunications technologies. It includes different alarming systems, sensing system, and many other devices and systems, telecare systems basically, based on technological solution that link people to health and social care services. These are quite helpful for patients who have long-term illnesses or conditions who need long-term care, the patients who need remote monitoring, who need monitoring and assessment of their vital signs, etc. So this telecare system is quite helpful for such specific group of people such as aging population. These are the references. You can go through these references in detail. These references will help you gain in-depth information on this topic. Additionally, you can go through these reading links that I have shared with you. Thank you. Have a good day.